Thoracotomy. Introduction. Each lung is divided into lobes. Select true or false. Correct. The right lung has 3 lobes and the left lung has 2 lobes. It is always possible to determine the cause of cancer in a patient. Select true or false. Correct. It may be impossible to specify the causes of cancer in an individual patient, but we do know what can cause cancer in some people. Are heart attacks and other anesthesia-related complications common during and after this surgery? Select yes or no. Correct. Anesthesia is very safe, but the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks or lung problems. Blood clots in the legs after an operation are harmless. Select true or false. Correct. Symptoms of blood clots include swelling of the leg, shortness of breath, and chest pain. In extremely rare cases, a blood clot can go to the lungs and cause death without giving any other symptom. Are infections very common after lung surgery? Select yes or no. Correct. Infections are very rare, but infections, bleeding, and scarring may happen. In cases of severe deep infection, another operation may be necessary. It is impossible to injure the heart or great vessels during this operation. Select true or false. Correct. Injuring the heart, great vessels, trachea, or feeding tube is possible, but extremely rare. Thank you for using Explain.